Today we'll be talking about what is high blood pressure. Because people come to me and say, oh, high blood pressure, is there any blood pressure that is greater than 120/80? Wrong. High blood pressure or hypertension is not any blood pressure that is greater than 120/80. That number 120/80 is for what we call the physiological man. And the physiological man is a male that weighs 70 kilograms and is 6 foot tall. I wish I was like that, but very few people actually are like that. So the 120/80 does not apply to you except you are that physiological man. For the rest of us mere mortals, the physiological man is a dream. But we have a way of measuring blood pressure, and it is individualized, believe it or not, because there are many factors that we put into consideration before we say you have high blood pressure or you don't have high blood pressure. For example, it's a range. Anything less than 140/90 in the doctor's office for the most part is considered acceptable, but even that is not always applicable to everybody. For example, if you are diabetic, your blood pressure should be less than 130/80, even if you are in the doctor's office. So like I said, it's not applicable to everybody, right? If you are over the age of 65 and you come to my office and your blood pressure is greater than 140/90, let's assume it's something like 150/93, that's still normal for your age, because as you get older, the lumen in the blood vessels get smaller, so the heart needs a higher pressure to push them out. So a higher blood pressure is acceptable for the older individuals. So it's a range. It's basically a range. That's why you have to see a doctor to tell you what's going on. While we are still at it, if you are 18 years old and your blood pressure is, let's say, 135/89, it's still less than 140/90, but for an 18-year-old, that's high, because most 18-year-olds will not have that kind of blood pressure. You see where I'm getting to? So blood pressures are individualized. So you need to see your doctor to figure out, is my blood pressure okay? Don't go by 120/80. It's a good range. I mean, if you have 120/80, for the most part, you will be okay. But if you don't have it, it doesn't mean you are not okay. That's what I'm trying to say. If you have a blood pressure that is less than 140/90, for the most part, you will be okay, but in a lot of instances, you may not be. And sometimes it might even be greater than 140/90, and you are still fine. It depends on all these other factors like comorbidities, age, and the risk factors come to play again. You're a smoker, if you've got a kidney disease, all those kind of heart disease, if you have a history of a heart attack, history of a stroke, all these things come to play. So it's not one factor, it's a combination. It's like a fruit salad, right? Combination of several things. So basically the lesson is, see your doctor about it. Don't just assume that you are hypertensive or that you do not have hypertension because your blood pressure is a particular number. And lastly, for blood pressure readings, especially for first time diagnosis of hypertension, we don't do snapshots. So we don't look at one blood pressure reading. We tend to look at it as a range. We want a trend. So you typically will need to see you 4 or 5 times before we make that diagnosis. Or sometimes, like I tell my patients, do the blood pressure outside the hospital, like 3 different times, 3 times each time you do those blood pressure readings, 3 different times. And then when I see you next, bring the blood pressure log along. For those who have the blood pressure machine at home, just do it every day for the next 1 to 2 weeks. Do 3 in the morning, do 3 in the evening, discard the first reading, write down the second and third readings, and then bring it in when you're coming. And then when I see you for the second time, I have blood pressure readings from other days, and then we can make a diagnosis at that visit. Those are some of the things that we do to help with the diagnosis of blood pressure. I said lastly the last time, this is the lastly. When you're taking your blood pressure medication, don't skip days. I know some people will say, I took it today because my blood pressure is high. I didn't take it yesterday because my blood pressure was normal. The medication is not designed to work like that. The medication is designed to work with you taking it every day. So it's better you take a lower dose and take it every day than to take a high dose and skip days, right? But these are not things you should do on your own. You need to get your doctor on board, please, right? I had a patient a couple of weeks ago, and she was arguing with me because she's a retired medical practitioner. So I told her, you cannot treat yourself. And you are retired. There's a reason you are retired, right? Because you're old. So you cannot treat yourself. It's against ethics, because you are not going to be clear-minded. You're not supposed to treat your family members as well. So trust your doctor. If you don't trust the one you're seeing now, then by all means, please get another doctor that you trust. And that doctor hopefully will be able to give you the kind of treatment that will work for you, right? Thanks for joining me. I appreciate you. If you've already subscribed, thank you for watching as well. And for those who have not subscribed, please subscribe to my videos, and I'll see you in the next one.